I didn't have a lot of hair loss as far as density. My hairline just kept kind of going back, but the density was there. And so I just kept looking, my forehead kept getting bigger and bigger. So it started bothering me about mid-20s or so, and I just felt like I felt older. It affected me, but I didn't have, I guess, a whole lot of hair loss, you could say, if another person would look at you. So if you look at my hair loss and then you look at somebody else's and you're like, oh, you're fine, I'd love to have your hair. But it affected me, and so it affects everybody differently. So I started working here, and then started seeing the patients before and after on there, and just saw the way that they had their procedures and the way that it was a normal, natural look when they did have it, and so it really changed my mind of kind of the negative thought of being a patient or a person who does a hair transplant. And so that you could see that it could be a normal, natural look and to it, and really undetectable where people wouldn't notice it. Dr. Bobak is not like your regular physician, a regular doctor. For him, it's personal. It really shows to the patients. It's something that when you come into the clinic, you're an actual patient. You're not somebody that's just in and out. We try to take care of you. He sit down with you. It's really personable, and he feels what the patients go through. Sitting down, coming in for a consult, walking through the door, doing the research. So he's all been there and sees that, and so it really puts a personal feel on it, and it's a personal touch because he's gone through it himself and knows what it's like to sit in that chair. Came in for the day of the procedure as normal. Every patient went through the process of getting changed and picking out lunch and things of that nature of it. And as you get closer and closer, and you finish each process, you know that you're one step closer to going into the OR and to the chair. So then it came to a point where it's exciting. It's a weird feeling, but you're finally that process of going through hair loss and looking in the mirror and not being happy is finally going to be over soon. Recovery was actually pretty easy, a lot easier than I thought it would be. When going through the process of it, you do go through a little bit of swelling, so it is normal and natural with it, but you don't feel any pain or discomfort with it, and you just look a little bit funny, but you kind of laugh with the process and enjoy it. But pain-wise was very minimal. I think only the night of I had maybe a little bit of minor discomfort, but other than that, it was pretty easy. I didn't tell any friends or family that I had the procedure until afterwards, actually. So when I went back home to Arizona to visit, I had a hat on, and I took the hat off, and my mom saw. And she looked at me and says, well, you finally did it. It was kind of relief, I guess, because you never know how people are going to react to it. But as I did tell other friends that I did have the procedure, they were actually interested in it, asked a lot of questions. And nobody said anything as like, making fun or a negative thought of it. Anytime that I go somewhere, nobody says anything, or go to get a haircut, a hairstylist, nobody says anything and nobody notices it until I actually tell them that I had a procedure, or they may ask, oh, what do you do for work, or things of that nature. And I tell them, and then tell them that I had a procedure, and nobody notices. They're actually shocked that I had anything done.